Hi everyone, Dr. Patrick Lynch here, and I'm just going to go over a case study of a 69-year-old gentleman who was previously diagnosed with polymyalgia rheumatica. So we might ask, what is polymyalgia rheumatica, and what is this gentleman's pattern that presents with polymyalgia rheumatica? Polymyalgia rheumatica is generally a diagnosis based on chronic pain due to no injury. It generally begins in the shoulders and or the upper part of the body and then starts to descend through the body over time, pain eventually encompassing the whole body. Polymyalgia rheumatica is considered an autoimmune diagnosis. So when we think autoimmune and we think about pain, we think about inflammation. And when we think about inflammation and the potential for inflammation, generally speaking, doctors will test people to verify that there are inflammatory markers that are causing inflammation in the body. And so this gentleman had some lab tests done, and they had found that he had an elevated ESR as well as elevated CRP, which is indicative of cardiovascular inflammation as well as inflammation throughout the body. And so inflammation can cause pain. And then we ask, why does this gentleman have inflammation? So we know that inflammation is triggered by the immune system. What does the immune system do? It helps keep microbes under control in the body, as well as it helps prevent the spread of pathogenic microbes in the body. The immune system helps combat pathogenic microbes in the body, as well as it helps prevent the spread of pathogenic microbes in the body. So, what does it do to help prevent the spread of pathogenic microbes in the body? When the body produces inflammation in a particular area of the body, basically what it's trying to do is it's trying to help prevent the spread of a particular pathogenic colony in that area of the body. When there's inflammation, you have less blood and body fluids going in and out of that particular area of the body. And when you have less blood and body fluids going in and out of that particular area of the body, then you're less likely to spread a colonized, elevated pathogenic load from that part of the body to other parts of the body. This gentleman was diagnosed with polymyalgia rheumatica. He had elevated ESR as well as CRP. He's a 69-year-old male, so he had time in his life for the pathogenic aspect of his microbes in his body to proliferate over time. This is what happens as people age. Their pathogenic microbes multiply and proliferate over time, and they start causing degeneration of the body. They start consuming the body. This is the cause of autoimmune disease, degeneration, and death more times than not. He came in with a cane and he looked terrible. He looked miserable. He sat in my chair. I've never met him before. And I asked him, I'm like, tell me what's going on. And he said, Patrick, I've been waiting to come in here for a couple of years. And my situation has progressively gotten worse and worse. And I don't care what I have to do. I'll eat dirt if that's what I have to do for a year, if this is going to make me better. And it's almost as if he knew what was going on, my treatment protocol, and he didn't, but he was ready to get better. And that's exactly the people who I want in order to help them help themselves get to the point to where they have their life back. They're out of pain. They don't have anxiety anymore. They don't have chronic symptoms. And so I'm like, okay, tell me what's going on. What's your presentation? And so basically, he shared with me that he was in debilitating pain and he does not sleep. So generally, with his presentation, he said that his pain began 10 years ago. It began in his shoulders and his neck and then his head, and then it descended throughout his body, in his arms and his hands and his hips and his legs and in his feet. His balance when he walked wasn't good. He frequently tripped. One of the reasons why is because he couldn't feel the ground beneath his feet. His feet were constantly in pain, burning pain in his feet, burning pain in his hands. When he went to go grab something, He would grab a cup and he would frequently drop a cup, whether it be water or whatever, because he couldn't feel the cup in his hands, and his hands were burning all the time. Everything he did was very purposeful as well as difficult. It was difficult for him to do. It was common for his esophagus to lock up. He would choke a lot. When he would go to swallow, he would really have to concentrate on swallowing. And it's almost as if he couldn't get it past a certain point. So eating was very challenging for him, let alone swallowing. He would have cramping in his hands and his fingers and his feet multiple times a day. Again, burning sensation in his feet and his hands. He had severe anxiety, short-term memory loss, brain fog. He had depression. He had cramping in his ribs and in his chest. He had electrical sharp shooting pains throughout his body. He had night sweats, nightmares, and skin rashes, and he couldn't sleep very much. He probably on average slept about 2 hours a night, he reported. He had numbness and tingling in his hands and his feet. He had teeth sensitivities. When he went to urinate, at times the flow was significantly slower than what it would be normally. He had angina-like pains. He had costochondritis-like pains and more. So what I do now is I have a list of his symptoms. So in 5 weeks, if he chooses to do a protocol that I put him on to help put this behind him, when we check in 5 weeks, I want to see this list of symptoms decrease. And then the next 5 weeks, I want to see it less. And the next 5 weeks, I want to see it significantly less. I told this gentleman, I said, hey, look, here's my cell phone number. Call me with any questions. I want to answer all of your questions between now and the time we meet again in 5 weeks, because this will best assure your positive progress. I want to see you improve. And if you don't have answers to your questions, you might not improve. And so then after getting his list of symptoms, I spoke with him about demographics. I want to know where he lived. Did he leave the country? When he left the country, did he get sick? If he got sick and when he left the country, why did he get sick? What kind of sickness did he get? Was this the beginning of a particular pattern of decline of health? What was his mom's health like when he was born and when he was a child? What was his health like as he grew up? I want to find out when his ill health started to present, even if it was minute. And that helps me understand where he was, what the integrity of the home he lived in case there was mold, if mosquitoes like him. Mosquitoes carry microbes, pilot the mosquitoes and tell them where they want to go. People generally have a pathogen associated with whatever it is that the mosquitoes are carrying. So, at any rate, I didn't really have to ask him that question because I knew based on his symptom presentation that mosquitoes did like him. And because he presented with a malarial type of infection as well as the potential for mold. And I verified mold. There was a lot of black mold in the previous home that he lived in 10 years ago. He had a big ring of black mold on his ceiling. There was a significant water source on the other side of his backyard, and there were lots of mosquitoes. And it was 10 years ago when his ill health started to manifest. And so there were two things associated with 10 years ago. One, mosquitoes, two, black mold. And then you think about, okay, we know black mold is a factor here. Black mold presents with pain. There's a lot of pain, a lot of short-term memory loss, a lot of brain fog, things like this with mold. And generally it presents with symptoms associated with polymyalgia rheumatica, as well as cognitive issues. And then we think, okay, what else is going on here? He specifically has anxiety, depression, cramping, electrical sharp shooting pains throughout the body, night sweats, nightmares, skin rashes, emotional highs and lows, burning pain, and he can't feel his hands and his feet and other neurological issues. Bingo. We're looking at a malarial pathogen here. We're looking at the strong potential for Babesia and or Bartonella. I know how different categories of microbes present in the body. And based on his exposure, based on his demographics, based on his symptoms, I'm able to figure out what his pathogenic load is abundant with. And so I have my eyes on mold. I have my eyes on malarial types of pathogens, whether it be Babesia or Bartonella or something else. And then at the same time, my approach is to go after all categories of pathogens. My approach is to just fully clean out the body of all categories of bugs. And that way we leave nothing behind. Then the person has a nice clean slate. This is a 69-year-old man who's going to have a nice clean slate with a very low pathogenic load when he's done with this protocol in less than a year. And he did it, and he's back. And so we'll talk about the treatment. So basically, I educated this gentleman to help keep his stress levels under control. I'm not going to talk about why too much, but keeping your stress levels, mental, emotional, physical, and environmental, keep those stressors under control. It's very important. The other thing is we want to detox. So we want to detox with one thing, S-acetylglutathione. It binds to all toxins, it binds to antigen, it binds to waste material from infections. It will bind to dead bugs and get them out of the body unless the body metabolizes them, which it commonly does. But S-acetylglutathione is very helpful for binding to waste material and getting it out of the body. It's essential. Liposomal glutathione, that stuff doesn't work. Acetylglutathione is at least 90% better. It's more expensive, but it's better. And then I had this gentleman on my dietary modifications. They are the elite dietary modifications. They are better than any other dietary modifications than you can find anywhere. And the reason why I know this is because I was riding the ridge of life and death. And if I had one bite of something, I would have symptoms that were somewhat lethal and I would have to be hospitalized. So I had to figure out really quick when I had Crohn's disease, when I had MS, how not to feed the infection. And I didn't know I had an infection at that time. I just knew that I needed to eat this way. Dietary modifications, S-acetylglutathione, keeping the stress at bay, herbal therapy, and for 10 months. And the herbal therapy changed and aggressiveness was increased once this gentleman started feeling better. So this gentleman was feeling better at about 3 months. He was feeling about 70% better. 6 months, he was 90% better. 9 months, he was done. We went 10 months, but 9 months, he was clinically done. I was happy if he was going to be done, but we went an extra month. He went from having pain everywhere, not being able to feel his hands and feet, shortness of breath, cognitive issues, burning pain, costochondritis-like pain, angina-like pain, inflammation when he went to go urinate, couldn't swallow without choking, to all of those symptoms gone. It is 2026 now, and this gentleman is still good to go. He has reached and remained in remission. He does not need immune suppressants. He does not need prednisone. And his life is back. He's strong. He loves life and he loves the great outdoors and he has his life back. And basically what we did was we cleaned him out. And so his immune system is strong. We don't need to suppress it. And there's a little case study for you. At any rate, polymyalgia rheumatica, chronic symptoms for 10 years, to completely back, ready to rock and roll. All right. If you are combating Lyme disease, co-infections, mold, mycotoxins, if you have an autoimmune diagnosis, if you have chronic symptoms such as pain, cognitive issues, mental health issues such as schizophrenia, bipolar disorder, vascular issues, urinary issues, consider following me. Consider calling me if you would like to have a consultation, and then we can go from there. All right. So have a wonderful day or evening, and God bless. Take good care.